And welcome back to Githinji Live. Let's go straight to the bench. Joining me live right here, the group CEO of Amref Health Africa, Dr. Githinji, everybody's favorite doctor. And on the far side, Kwame Owino, he's the CEO of the Institute of Economic Affairs. Gentlemen, thank you so much for joining us on Githinji Live. Dr. Gigi, let me go to you first. March 27th, the president declares a curfew, 7 p.m. to 5 a.m., okay? That's about, 10 weeks ago. Back then, Cabinet Secretary for Health, Gitahi, kept saying, stay at home, do not venture out, stay at home. Back then, we had about 10 cases. Today alone, 123. Total, more than 2,200. You know the numbers better than I do. Dr. Hari, and now there's talk of opening up the economy. Does that make sense? Lifting a curfew? Does that make sense?
Well, I think it's a complex question, Jeff. It's not a very simple question. And I think I've said before that this issue of how to manage the transmission or reducing the transmission is not necessarily an on or off switch. It is actually a dial that you have to manage and kind of regulate. So where we are, let's take some few facts. Let's say Kenya has coronavirus. Yes, that's a fact. The cases are rising. Yes, fact. And we know that they are going to rise fast enough. We said we expect the peaks around August, September. So, there's no assumption that the transmission is not happening and is not increasing. So the question then is, as you refer to 27th of March, where did the president take the measures that he did? Globally, for any epidemic, the best way to manage, especially for an infectious disease like this, is to reduce mobility. Now, when you reduce mobility, in the absence of a vaccine, you're basically saying that you are reducing the rate of infection or the rate of how many people one infected person can pass the virus to. And the aim of measures is to ensure that one infected person can only pass the virus to one or less people. In fact, the better, below one, the better, because then it means that the virus transmission then is on the decline. If the rate is more than one, that one infected person can pass it on to more than one, then the higher that more than one is, the higher the replication factor of the virus. And you can range whatever measures you want to take. Complete lockdown on one side is the one where there is evidence that it can reduce the rate of transmission from one person to less than one, meaning that you can actually stop the infection. But then you know that a total lockdown is not consistent with an economy for a long time. You can do it for a short time, and therefore many governments that did it for a short time were doing it for the purposes of preparation. It was not for rate to end the virus. It was to say, we are now prepared, we have a better health system, we know what to do, we have enough testing capacity, doctors are prepared, hospitals are prepared, let's now start to ease the lockdown so that you can now create a balance between lives and livelihoods. That's what every government is doing. So even the reopening is not about let's open or not open. The question is, how do you balance lives and livelihoods? So how do you now manage to live with a reproduction rate or with an infection rate of one person infecting more than one, meaning the virus still spreading, but reduce it from going up to maybe one person to 4, but live with one person transmitting it to 2 or 3, meaning now you keep the rate of transmission low. So the reopening or the minimizing the restriction is inevitable. That will definitely happen. Because as I've said, from lockdown, you prepare yourself. So Kenya did not do a full lockdown. They did these measures, curfew, cessation of movement, and there come a time when you say, fine, now we've done this, we think now we are prepared to actually deal with a slightly higher reproduction number. If maybe we were achieving 2 people for every 1, now we are happy to live with 3 people for every 1 infected because we are prepared. That's what we are saying. So the president has to, to balance this based on the evidence that's given to him by the specialists that we have. So it's inevitable we'll have to ease the restrictions. But then the question is, how prepared are we for the higher transmission number that will happen? That's really the question, because the number will go up as we open the economy. The question is, are we prepared for that higher number? And if it's yes, then you reopen. And I think that's the question we need to ask about. Are we ready to deal with a higher number of reproduction of the virus? And if yes, then we should go ahead and open, Jeff.
Let me ask the economist, Kwame Owino, from where you sit, are you for easing restrictions and lifting the curfew? Are you for or against?
I think, yes, just as Dr. Gitahi has mentioned, it's a complex question, but this is what I look at. When the first curfews were announced and the president actually issued the order for everybody to stay at home, at least for the curfews to work between 7 o'clock to 5 a.m., we were told two things were happening. One of those was to flatten the curve, which was a cliche thrown around. And as Dr. Gitahi has mentioned, what you do by that is actually just buying yourself time to be able to prepare, to ensure that you're reducing the infection sufficiently to give you time to prepare, whether it's infrastructure, to place doctors around, to get the tests that you require. Now, if you ask me right now, I think up front, I doubt that we are ready to open under any circumstances for two reasons. The first one is, if you look at the numbers, I think we are lucky. We are lucky in the sense that the infections have not overwhelmed. And even more importantly, that while we've had sad deaths, we haven't had too many of them so far. I mean, the numbers today suggest that there are 74. It is clear there might be more than that, but the numbers suggest there are 74. Now, the other thing that we were buying time for is to be able to learn the virus, to actually say what's its behavior in our country, in our environment, and what do we need then to actually help to reduce its spread. But even when you help to reduce its spread, when people get unwell, what do we do? I'm not too sure that we understand enough. So, for instance, the original model had it that we'd expected by the end of April, which is about 6 weeks ago, about 10,000 people infected. Our numbers today suggest that it's actually just about 30% of that. We are not too sure why. What is it that has made us lucky? Did we escape any bullet? Or is it that the measures that we put in place were so effective that we've actually bought more time than we do? What worries me the most, however, is that while our numbers of infections are low, the recovery rates are extremely slow. So while we had an extra 120 people today, between yesterday and today, less than 30 people have actually recovered, based on the numbers that were declared, suggesting to me that actually the infection rate is much higher than the number of people who are recovering. Yeah. So when you take those two together, there's still a huge amount of stuff that we don't know. Maybe someone knows them in the Ministry of Health, but they don't give me confidence that on the basis of those numbers alone, they know how to turn the dial, as Dr. Gitahi said. And that's a worrisome thing.
You know, Kwame, when you mentioned dodging the bullet, I saw Dr. Githinji nodding. Let me turn to you, Doctor. Did we dodge the bullet?
You know, Jeff, this question has been asked many times, and I've had some people say, you know, Africa and African countries and Kenya are escaping the virus. I think we must realize that the reason the infections are not as they were projected is not by chance. It is because measures in many countries were taken very early. If you think about it, you know, you're talking about introducing a virus from outside, and therefore when you close the borders very early, it means that you brought in people with the virus are fewer, and therefore the rate of reproduction from those people to others is low. Remember that not all people infect others at the same rate as others. We also have the factor I was talking about earlier about some people are super spreaders, others are low spreaders. So the more you introduce, the more you are likely to have people who are likely to be super spreaders spread to others. So early closure of borders across many African countries, including Kenya, was a major advantage. You remember that in this country, when the president made the order to quarantine people who were coming after a particular date, and there was a lot of anger and anxiety, the initial numbers of positive cases came from the quarantine centers. So imagine if we didn't close the borders, we would be talking about a totally different number, because you know one person can be the result of 200 cases of infection. One person. We know from international data that actually a lot of the cases, 80% of cases may come from only 20% of infected people, and then they infect others and others. It becomes a chain reaction. So some of the measures that were taken, what Kwame is calling dodging the bullet, were actually purposeful measures. They were not by chance. And that's why you're seeing a lot of African governments actually delaying in the curve, because they took the measures very early. But the question is, with the community transmission we are seeing now, with the pressure to balance between lives and livelihoods, we are now starting to see that acceleration is starting to happen. So as we start to open some part of the economy, we will definitely see a rise in numbers. We will definitely see that.
Let me ask
the question is whether, if we are moving from 120 a day to 300 a day, how many people need hospital care, and are we ready for them? Are we ready to trace? Are we ready to test? And are we ready to manage the epidemic? That's really the question we need to ask ourselves.
Okay, let me ask you this in retrospect, Doctor. Should we have been under total lockdown for the last 10 weeks? And the reason I ask this is, look at Italy, look at Germany. They were under total lockdown. Italy's numbers were shocking, they're horrendous. But now they seem to have flattened the curve. They have no new infections right now. But on the other hand, countries like Iran, South Korea, total lockdown, reopened, boom, spike. Where does Kenya lie in this?
I'm on the side of we should never have done a lockdown, a total lockdown, and the measures that were taken were, in my view, adequate. A total lockdown, you must remember that every life is valuable. Whether the life dies from, whether you lose a life because you couldn't access maternal care and therefore because of a lockdown and therefore you died because you couldn't deliver in a facility, or you died because of malnutrition, or you died because your medication was not refilled, that life is equivalent to a life, from COVID-19. And therefore, what we must remember is that lockdowns are inconsistent with informal economies. That is a key thing that we have to think about, because lockdowns affect the vulnerable most. Lockdowns affect the poorest most. So the bigger part of the poor you have, the less likely that a lockdown is going to help you when you do the balance between lives lost because of COVID and lives lost because of other things. So I go on the side of we should never have done a lockdown, and therefore the measures that were put in place, I fully support them. Now the question is, when you do a lockdown, because a lockdown is not an end in itself. A lockdown is a means to an end. You're doing a lockdown so that you achieve 1, 2, 3, 4. What is it that we could have achieved in a lockdown that we didn't achieve with the current measures? In my view, nothing. We actually have, even with the current measures that allowed some level of the economic activity to continue, we've achieved increased testing capacity, we've achieved increased hospital, health system capacity, PPEs or protective equipment for health workers. We are more knowledgeable. We have done hand washing stations across the country. People are aware of what to do. Containment measures have been done. We could have achieved the same with a lockdown, just that maybe the lockdown would have ensured that we don't have 120 cases a day now. We have maybe 5 or 10. But because it's inconsistent long-term with the economy, then you still have to open. And when you open, then you have to be ready that now the spike goes up. So I would say that the lockdown was never would never have been a better solution than what we did, and we did the right things. The question is, now with the, kind of the soft lockdown that we have, is it time to let that go as well? And that, my answer to that is that we can only do that under certain circumstances. It's not an open or shut case. We can only do that under certain circumstances. And if you allow me, I'll say those circumstances. Number one is that we need to be very clear that we have done our modeling and we know how many cases to expect under removal of the restrictions. We know very well that cessation of movement, and we know, if you go to Apple and Android phones, they're tracking movement of people. And we know countries that have dropped their mobility or movement of people to rock bottom have less cases. So the question is, when you open, then there is movement, then you expect the cases to go up. The question is, can you model and say, if we are at 203 a day now, when we remove these, we'll end up at 300. Out of 300 a day, we expect 5% to end up in hospital. What does that mean by the time we are 10,000 or 20,000? And plan accordingly. Maybe there's a time to say we are going to open, but we must make sure everyone has universal health coverage. Everyone has an NHIF card. So that if you are coughing, you go to the hospital. So these are the things you need to put in place. But remember, opening also means that you continue the containment measures, masks, social distancing, hand washing. Those things must remain, and there must be a plan. The final thing you must have when you're thinking of opening is, we have seen very clearly, Jeff, that the severity of the disease is different at different ages. For young people, infection with coronavirus means absolutely nothing. The risk is very, very low. But then there are the ones who take the virus and spread the virus to the people who are vulnerable. Now the question is, if all the men above 60 who have been identified or lab confirmed to be positive for COVID, 30% of them have died. That's what we should worry about.
Right.
We should worry about the vulnerable. If we are reopening, you must ask the question, have we thought about the teachers who are above 60 if you're opening schools? Have we thought about the teachers who may have hypertension or diabetes? Have we thought about, even when you're opening restaurants, that there are waiters who may be above 60? We need to think about these things before we reopen. So it's not, the reopening question is not the big question. The bigger question is, are we prepared?
Are we prepared for the new normal? Kwame, let me ask you this. Hundreds of thousands, if not millions of Kenyans have been out of work the last 10 weeks. A lot of them are angry. A lot of them are getting hungry. Some economists say this economy of ours may reach a point of no return or non-recovery. Are we getting there? Are we going to reach that point where we cannot recover from this pit we're in?
Okay, first let's start with the fact that economies are very resilient things overall. So what would happen is, I think what will happen is basically that our recovery will actually be extremely delayed, and especially for urban areas. So we're talking about the urban area places. And just to add something, to modify something that Dr. Gitahi said, I actually believed that the cessation of movement, especially in urban areas, because if you remember, the virus moves in certain places. Density of population, which is something that Nairobi, Mombasa, and a few of the outlying areas have quite a bit amount of. So by the president actually modifying by saying, look, you cannot move between Mombasa and between movement in those specific hotspots, I actually think has been a huge help in my view. So while restrictions for, say, some other parts of the country would not have made a much of a difference, I think the fact that many people could not get, yes, and I know there are people who had tricks and they managed to go, that in my view has been decisive. I think the second point that has been decisive is actually the closure of schools. One, for the precautionary principle. We did not know in February and in March what actually it portends for school kids. Remember, in Kenya, we have 16 million children who wake up every day and go to a public school. And the possibility of spread, and some of those kids sit 80 people in a class of, 20 meters squared, something like 30, 40 meters squared. So obviously the possibility of spread, even if the mortality for them is low, was actually big. So my view is that part of those two were decisive. The policing part and everything else we know worked one way or the other. So now coming to the economic part. In urban areas, obviously people need to work every day. So definitely there are people who've lost some jobs. But the stress actually also went back to small and micro enterprises. So it's not just the informal economy part. We have these people running 4-5-man farms, very highly formal. But because people can't come to work, or people can't come to for those services, say barber shops or other people who provide personal services or even goods, because you cannot supply it in those days, some of those farms have suffered serious damage and it's unlikely that they'll survive. What we need to work ourselves up to, and that's why how we shift that dial is important. And I'm worried because we don't have the right data to tell us what are the circumstances in which the super spreaders in Kenya worked. And if you only have 80,000 tests that are being conducted over close to 90 days today, then we haven't done well enough with that testing to be able to understand how does this virus, quote unquote, behave in the Kenyan sphere. That is what is most worries me the most. So if you're going to ask, there are some businesses, unfortunately, that are not going to come back because of this. But I think as soon as we have a grip of what, or rather the preparation is ready and stuff like that, then obviously the opening will have to take place. And I think the places that are priority would probably be urban areas. But there was a delay in terms of government support for how businesses could have kept in shape, and therefore there's been a mismatch. Some people, as soon as the opening takes place, will have been so badly shocked, and they'll be in such difficult shape that many of them will probably try to travel back to rural areas, just running back to refuge because you've lost your job, you haven't had pay for 3 or 4 months. I think many people will actually try to cushion themselves by going back to rural areas. So yes, I think some damage has been taken, and it's going to take us a while to recover back to the growth levels that were expected, 6.2% this year. Yeah. It's going to come down to even half of that. We'd be very, very lucky.
Kwame, what about the stimulus package for low-income households? Has that helped to cushion them?
I think it has. though obviously it's also been handled in a way that's not entirely transparent. So I can't tell who received it and who did. But you see comments here and there. That stimulus package, or rather that support, basically it's social support, social protection, was supposed to be provided to urban areas and rural places with the poorest people. Now, how it was transferred is something that's not very clear. But yes, there are people who received it and it was helpful. Notwithstanding the fact that it was modest, it was helpful. But its distribution should have been informed by who are the most vulnerable people. And urban communities and people who actually sat in urban areas and places where people couldn't come to work every day should have been a priority. Of course, to rural areas, places that say suffered other shocks. You remember also the floods, other people who lost crops because of the locusts and everything else. So as a whole, we are managing the whole economy and all these shocks coming together. So yes, that definitely helped. But I'm not too sure how well it was distributed in a way that gives us the best springs to get back when the reopening takes place.
Yeah, okay. Dr. Githinji, your big mantra for many weeks was flattening the curve. We need to flatten the curve. We need to flatten the curve. The curve hasn't been flattened, and we're thinking of opening up. What happened to the curve?
The curve is still there, Jeff, and I think, when we talk about flattening the curve, it basically means that if you look at the numbers that were modeled before, not only by our own scientists, but the scientists from other places across the world, was that if you leave everything untouched and you do nothing, then we were expecting to have much higher numbers than we do have now. So the curve is flatter, actually. If you look at the projections that were talking about 1,000, 10,000 by mid-May and that kind of thing, and now we are now reaching 200 plus, it means the curve is flatter. It is below where it should have been. I am more worried, actually, about the other effects of flattening the curve. I must take this opportunity to obviously condemn, police brutality and say it was totally uncalled for, and we should not have had measures that led to other loss of lives, preventable loss of lives, or loss of lives that were preventable through police brutality, through people lacking essential services, mothers who needed to deliver in hospital who couldn't. Those are the things that should worry us about what is the other unintended costs of flattening the curve. The curve is flatter, definitely, no doubt about that. The question is, what are those other unintended consequences of flattening the curve, which is why the discussion around how do you now keep this new normal, where actually you do not have to enforce measures of communities through police brutality, that you actually do that by community ownership, that the next phase of deciding whether we open or not, or how much we open, and therefore how much we can live with. Remember, I keep referring to this number of how many people can one person infect. One infected person, how many people can they transfer to? That's what the public needs to remember, that the aim of all these measures is to ensure that one person infects as fewer as possible towards zero. Right now we know 1 to 1 is what we aim to, or 1 below 1. But right now we are doing 3 to 4 for one person. So when we open, and now this number goes maybe up to 4, what is it we need to do ourselves without having to have the police enforcing borders and battening people at night, that actually we can take ownership of this and say, we want to go to containment. And the containment means that we are going to participate in wearing masks willingly. We are going to participate in hand washing willingly, of course, with support of government where there are no hand washing facilities. I was talking the other day to the education sector and saying, if you are planning to open schools in September, there should already be a database about how many schools have running water, how many don't have, and what's the plan for that. There should be a list of that. So as we reopen, then we must be ready ourselves to participate in obeying the public health measures, not government measures, public health measures that are going to make sure we contain. The next thing we must be ready to do is willingly shield the vulnerable. If I am a young person and I live with my father, and my father is 55 years old, then I have to make a choice. as to whether I'm going to expose my father by going to work and to crowded places, because remember, when you go to crowded places where your chance of getting infected increases, then you also have to make a personal choice and say, I have a vulnerable person at home, discuss the family and say, what do we do? So basically we are saying, as we move to the next phase, because these measures cannot be there for a year as we wait for vaccines. That's what we must remember, that we cannot have these measures for a year as we wait for vaccine. We have to own the response ourselves as we call for releasing or reducing the restrictions for the measures. But the curve, to go back to your question, is flatter than if we didn't take the measures.
Okay, gentlemen, I want to take a quick break. But before I do, there's a message for both of you from Dr. Manu Chandaria. Kwame, to you first. He says, we need to reopen the economy as many daily earners are sitting at home not earning anything, and there's not enough to eat, and it's not possible to hold this way for much longer. That's to you. And to Dr. Gitahi, he says, this is Manu, who's 90 plus, right? He says, we have lived through many pandemics in our lifetime. COVID-19 will not be any different. More will come. We just have to have the resolve. And then he says, doctor, stop lecturing us. We're going to take a break.
I will lecture him back in the next session.
We're going to take a break, come back. These gentlemen are calling it like they see it. To open or not to open the economy. I tell you, folks, it's a tough call. Something has to be done. Keep tweeting. We'll read your tweets very soon. At Koinange at Citizen TV. Can you the hashtag? JKLive. JKLive takes a break. We'll be back in a moment.